I'm going to talk about PED as a warning shot for national biosecurity and foreign animal disease preparedness. My goal for today is to raise awareness of foreign animal disease preparedness and response programs, but also to utilize the PED experience as a springboard to encourage producers and veterinarians to capitalize on the industry and regulatory development to prepare for future challenges. Like Jim said, I have a background in clinical practice as well, both private and corporate in Canada. And recently completed now I'm at the university, but I recently completed a residency at the University of Minnesota, which had us on several different projects. The key one for this presentation was called Facilitating Public-Private Partnerships, which was all about foreign animal disease preparedness and response, and bringing subject matter experts like yourselves together with regulatory people to work on risk assessments. And I work specifically on risk assessments for the movement of animals and animal products in broilers, turkeys, and we were starting to work on the swine project when I finished my residency. So the first term, I'm going to talk to you a little bit about a number of the things that have developed in that work. And I think the cornerstone of a lot of this development is all about something called continuity of business, and you've probably heard a lot about that. Originally, the response to foreign animal diseases was all about detecting, movement control, and also stamping out, so eradication. But over the last 10 years, a very good development has occurred, which now includes continuity of business. The third goal here in the USDA's foreign animal disease response goals, and it's based on science and risk-based approaches to facilitate continuity of business. And after all, this is extremely important. We need to recognize that a regulatory reaction to a foreign animal disease can have a huge impact on our business, and if we don't consider the importance of that, then there's a great deal of damage done in the long run. So being able to recover quickly needs to also take into account the fact that there may be sites that are able to move products, animals and animal products safely in the face of an outbreak. So typically we think of a foreign animal disease outbreak in the terms of a control area when it comes to movement control. And I just want to remind you that a control area will be set up in the case of foreign animal disease outbreak, but it's not only going to be potentially a 6.2 mile radius, but it will likely start out much larger than that. It could be a whole state, it could be multiple states, or it could be the whole country. So I don't think a lot of us think in those terms, that we actually might stop movement of all animals and animal products for the whole country until we get things figured out, or for multiple states. The flowchart on your right is to remind everybody that premises within a control area will be classified, and they'll either be within or outside of the control area. If they're outside of the control area, there'll be a free premise. If they're infected, obviously they'll be depopulated. And then they go through a number of different classifications, which I won't go through specifically. But the end game here is that if you're within a control area and you're allowed to move animals or animal products, you're going to need a permit. And that permit's going to need to be written by an incident commander or signed off by an incident commander. And this is really what continuity of business and the secure commodity plan projects are all about, right? We're trying to facilitate this process ahead of time so that when an incident commander who doesn't know a lot about your business is willing to put their name on a permit that says you can move product or animals, right? And so they want to be backed up by something. That's where risk assessments and a lot of the secure plans come into play. So this is another way of saying that. At the end, a permit is issued. Before an animal disease outbreak, these are the sorts of things that can be done. And this is what the USDA is funding a lot of the activities that are going on, and a lot of us are involved in. Risk assessments are completed proactively, and that's what we've been working on at the University of Minnesota. Voluntary preparation steps occur. So when we're talking about secure plans, this is really where that fits in. You can see that there's GPS information, traceability information required, surveillance plans put in place, and here's the biosecurity piece, right? So those are the voluntary plans. This is these types of things are included on your secure commodity plans. And then what's created out of this is permit guidance. And what a permit guidance is basically referring to is that there's a checklist to create that permit, and the incident commander will go through and say all of these things have been done and are in place. So if you have a biosecurity plan that's in place, you have all this done, it's much easier to check that off quickly. And if we are within a control area, you've got to remember that anything that moves into, out of, or within the control area is going to need a permit. So you can see this is the incident commander looking over all this, creating the permit. And that's to ensure that we're minimizing the risk. Remember, we never know 100% that an animal is infected, but what we're trying to do is minimize the risk of moving infected but undetected animals and animal products. Minimize the risk. That's where the risk assessments come into play. All right, so regulatory policy. I want to quickly go over that and just remind you that since 9/11, there have been a lot of developments in this country. You can see there's very little before. This talked about critical infrastructure, but it didn't specify the agriculture industry at all. Where right after 9/11, then things started to happen, and there were some key things that came out of that legislation. Basically identifying agriculture and food supply as a critical infrastructure that was vulnerable and needed to be protected. There was increased funding for USDA partnerships with higher education. And there was a mandate to the USDA to improve emergency response. And you can see all of the different networks and systems that have come out of that or have been improved as a result under the USDA's mandate. All right, as well, Homeland Security became involved through centers of excellence, for example. I want to just point out that these centers of excellence are at different locations, and there are more than these, but I want to list these especially. So, business, or continuity of business, is the groundwork for a lot of the work that's been done, and my goal is to bring awareness of these activities to you so that, and maybe encourage everybody to look for opportunities to maybe capitalize on some of these activities now with a disease like PEDV, and not only wait for a foreign animal disease. I think there's lots of opportunities to actually capitalize and put your tax dollars to work for yourself right now. A lot of plans that are in place are looking for ways that we can maybe use some of this work on a day-to-day basis. The next thing I want to talk about is risk communication. When the disease was first announced, the ASV put out an internal communique to its members through its website and used wording like I've highlighted here. OIE lists of foreign animal diseases, transboundary disease, an immediate report to the OIE, and the need that does not necessarily need to be done because of the nature of the disease, as well as quarantine and movement controls, right? So I really wanted to highlight this language. After doing a residency in public health and preventive medicine, this is the kind of stuff that jumped out at me, and I thought I was very impressed that it was addressed. In the second communique, which was more public, I think the wording became even better. And I think that a lot of thought and expertise went into this risk communication, and I want to give kudos to the ASV for putting that kind of memo together. But I think there's some important messages here that we learn from the experience that reminds us about how the game might play out in a foreign animal disease scenario, and also to remind us that we're doing a lot of things well. I want to educate everybody a little bit about what a listed disease is and why this is not considered a foreign animal disease, although it was foreign to North America. Why there's no interstate trade restrictions and why it's important. I think this is obvious. I won't talk too much about this, but why it's important to include these types of statements in risk communication. Everybody knows, I think, that this disease has made it into national press. And I think a lot of these things were reiterated quite well in a lot of those reports. And so It's extremely important for us to understand that the way this was approached is important, and it was done well. So what's the proper disease terminology for PEDV? Well, we hear a lot of terminology thrown around, and it gets confusing, right? So I just wanted to quickly point out that we hear about emerging and re-emerging diseases, and this is actually a human referring to emerging and re-emerging diseases in humans, but I thought it was quite applicable. So typically it's detected for the first time in a location, or for the first time in a specific population, all right? So it might already be present in a country, but it's emerging in a new population, which is abnormal. It may also be already, in fact, emerging diseases are often already present, but they haven't been detected, right? It may have been clarified as a link between a chronic disease or syndrome, and now the link has been identified. Re-emerging is just the fact that it was already there in the past, it was under control, and it's shown up again. From a foreign animal disease standpoint, basically, I think we think of these as high-impact diseases for which individual countries are negative. And individual countries and provinces and states often regulate these through legislation. They refer to them as reportable, notifiable, or named diseases. The limitation with the term foreign animal disease is that it does not account for these diseases which are of domestic origin. They're actually not foreign, but they show up in your country. You've actually already had them. You're just now identifying them as an emerging disease. So the UN came up and encourages the use of a new terminology, although foreign animal disease still shows up everywhere in the terminology, of transboundary animal disease. All right? And basically, they define it in this way, and it's their way of addressing foreign animal diseases that are of domestic origin. So really, you could refer to PED in this country as being an emerging disease, a foreign animal disease, and a transboundary animal disease. I think they're all right, but they need to be used properly and in the right context. Prioritizing disease internationally and determining trade response. So it gets kind of confusing when you look at the OIE list of diseases, why some are important or some are not. I think I would have brought the perspective or the paradigm that if it's on the OIE list, that is a foreign animal disease and it's something that could cause a lot of trouble to a country, and that's not necessarily the case. I had to ask the question as well, why is PEDV not on the list and TGE is, especially after hearing some of the presentations about the disease and hearing about how aggressive it is in Southeast Asia. After you hear a little bit more of the presentation, I think you probably asked the same question. And what are the international reporting responsibilities? You'll remember that the AASV communique mentioned this, and I think that's important for us to understand as well when we're thinking about PED and how a foreign animal disease that's listed and considered to be a high impact might be responded to. And how do sovereign nations determine their trade restriction response or lack thereof? So when it comes to foreign animal disease policy and regulation, countries typically cooperate in the interest of trade and commerce, right? That's why we're cooperating. And we are therefore motivated to keep foreign diseases foreign because we don't need our trading partners stopping the flow of product. There are basically two organizations that are involved internationally on addressing foreign animal disease in the preservation of the public goods. Or in the interest of public good. And they pay attention to things like animal health and welfare, socioeconomic impact, and of course public health. When it comes to OIE reportable diseases, there are actually 130 diseases of interest. And they used to be listed in different categories, I think according to their severity, but now they are listed according to species that they affect, as well as if there are multiple species. And they consider international spread, significant spread within naive populations, zoonotic potential, and emerging disease potential, or definition, I should say, in their criteria, in their flowcharts, in their decision-making process. For your information, these are the swine-specific listed diseases of the OIE. And some of those you'll recognize as being the big names that we often talk about. And I guess I was surprised to find that PRRS is on the list, as well as TGE. Traditionally, I would have been thinking primarily of vesicular diseases. And these are reportable diseases that affect multiple species, and that's where FMD and vesicular stomatitis would have jumped to mind for myself. But you can see that we are in North America positive for many of these diseases, and it does not affect necessarily our trade with many important nations that we trade with. So important take-home point, and to recall. When it comes to member nations notifying the OIE, there's something called the OIE Central Bureau. And basically that's this part right here. An infected country is to notify them, and they react by notifying the other member countries. And criteria for reporting include that it is a first-time occurrence or reoccurrence, so emerging or re-emerging disease. That is potentially a first-time occurrence of a new strain of a disease that you're already positive for, or a sudden change, so an epidemiological change, I think, or the change in the way the disease is acting. I guess the epidemiology is down at the final point. And if it's an emerging disease with significant mortality, morbidity, or zoonotic potential, this is something that's supposed to be reported immediately. So it would be interesting. I have heard a couple different opinions on whether or not PED should have been reported. Of course, in the ASV statement, I think the initial memo to members discussed the fact that we could wait till the 6-month or annual report. As far as frequency of reporting goes, this is the other thing that happens. If it is an outbreak that's been reported, then it is to be reported on a weekly basis until that disease has been eradicated or has become endemic in the country. And then everybody who are members are reporting every 6 months regardless of whether or not they've reported an emerging disease, and annually as well. So in turn, the Central Bureau notifies member countries, as I mentioned, and they also put the information into their World Animal Health Information Disease Database. So how do sovereign nations determine their response? And that's nothing that's legislated. As far as I can tell, that is an independent decision by trading countries. And in my opinion, these are some of the things that might be related to their response. The real risk associated with a new disease coming through products that are being traded, as well as obviously political relationships, trade relationships, and sometimes special interest groups will play a role in the political decision, I think. Are there other porcine diseases of concern? I think this is a question that a lot of us answer. If PED doesn't sort of fits in the cracks, and it certainly wasn't on my radar as a potential threat. Are there other diseases of that nature? And I think those are some of the things that we have to ask about. This is a listing of porcine viral diseases that, showing when the year that they emerged, so PRRS, circovirus, 91, 97, and so on, through some viruses that we don't hear so much about. But are there, in the case of PED, I mean, I don't think it actually fits really into this type of disease where, it was in other countries causing a serious problem, but not necessarily on our radar. I think we need to raise our awareness and think about the potential for other incursions that don't necessarily fit into the typical line of thinking when it comes to foreign animal diseases. Okay, the other part is the domestic response. So we talk a lot about our domestic response. That's a lot of what was going on at the conference. And I think it's important to think about, like Albert and like Dane has said, there's a lot of things that we're doing extremely well. And I think probably the United States, North America, and Canada lead the world in response and preparedness in many ways, as well as many countries in Europe, obviously. There's a lot going on that on the preparedness side, but we're always looking for ways that we can improve. So I borrowed this slide from Will Houston, who was my advisor when I was doing my residency. And he reminded us on a regular basis that within the United States, the federal government exists to protect the country, to oversee the protection of the country, as well as negotiate, as far as overseeing everything that is involved with interstate commerce, obviously negotiating international treaties, border protection and international trade, and levying taxes. We all know about that. And so otherwise, everything is relegated to the states. I should have capitalized that, but that's the individual states. All right, so it's important to understand that is constitutional here in the United States. So often state and federal authority are debated. Who's going to act? Whose responsibility is it? But if it's affecting anything that moves products, animals and products between states, then the federal government has the right constitutionally to step in. All right. These types of plans for animal disease, preparedness and response plans, have been getting developed over the last 10 years, and it takes a lot of work. These are 200-page documents, and there's a lot of good information in there, and I think a lot that we can learn from and take advantage of. So I would encourage you to have a glance over those. I would also encourage you to go online and look at the secure egg supply, the secure pork supply, other activities that are occurring, because there are things that we can take advantage of in the meantime, not just wait for a foreign animal disease to look at these types of activities. I want to encourage practitioner level opportunities. Basically, we talked about the awareness of potential emerging diseases, the awareness of both the international and domestic response, as well as, this is a very important point in my opinion, it's important that we don't confuse these secure plans or any of these continuity business plans with a regulatory action. These are voluntary plans. They're voluntary. The USDA is funding them, but that doesn't make them a regulation that's going to happen when a break occurs. It's up to individual states to adopt them. All right. So one thing that you can do is make sure that your state representatives are aware of these plans. They're not always aware of these plans, even though you'd assume that they might be. It just doesn't always come on their radar. But in the face of an outbreak, if one state knows that another state has adopted these plans, then there's a consistency and a standardization that gives them faith that they can move product through their state, right? Because these are the things that are occurring. So it's important to understand that. I also want to remind you that there will be opportunities to be subject matter experts in the completion of the proactively completed risk assessments. Continued development of comprehensive, well-documented biosecurity plans is important. Because if you're doing that within your system, it's well documented what you're doing. That will fall into place during the production of those permits, all right? So encourage the continued development of that. I want you to be able to explore USDA-funded developments that facilitate disease management. So I want to highlight in this particular case some of the work that the Foreign Animal and Zoonotic Disease Center of Excellence for Homeland Security has worked on, such as Ag Connect and a couple of other programs, which I'm forgetting the name for at this time, but this one here is actually a syndromic surveillance that will make it possible to submit syndromic information through your iPad or iPhone to a database to help monitor for disease. The final one that I have here is to promote data validation and geospatial management initiatives. So Dane talked about the VBL and the premise ID work that's being done. I think the ARC&E work completely fits into some of the promoting some of the information and knowledge base that needs to be in place to recover quickly in the case of a foreign animal disease break. So I would encourage continued involvement in those and development. And then obviously the collaborative laboratory surveillance efforts are extremely important and will help in quickly identifying when we're talking about surveillance.